eligible for wages anymore, is for promotion, put her above in salary for what our wages limits are. Because we want to make sure that our resources are going towards the lower paid folks. In the Des Moines area, we go up to $18 an hour. So it does get people to what we would call a living wage. But now that Bethany's been promoted within the center, she's no longer within that limit. So we're delighted that that's the problem that we have in continuing to support her. I want to introduce Dara Madigan to you. Dara's our wages program coordinator, and she has a little something to present to Bethany.
Come up here. I guess and ask Bethany to come back up. But, even though she's no longer eligible for wages, she did just finish a commitment period, so we were able to award her for the time until she got a promotion. So we brought your last wages.
Thank
back.
you so much.
Thank you very much.
I'd also like to introduce to you Kyle Upchurch, who is our public ally with our AmeriCorps program. And Kyle's been working, he's in the back here, he's the one who sent out the press releases. He's been working hard all year as a volunteer through that Public Allies program to support wages within our agency. We also have with us Jessica Doppler, who is in the middle in the back, and Jessica is going to be our wages program, or she is our wages program assistant, and so she's helping Dara with all kinds of paperwork and marketing and data collection for the wages project. So I apologize to those of you who walked in after I gave my speech, but I'm glad to do it again. Or I'm glad to answer any questions that you might have for me or one of our staff about the project. And we really appreciate, yes, go ahead.
So just, you're saying that you're introducing more wages programs this fall. How long does that money go? You know, how long is this program going?
Typically, when you're using grant and foundation money and public funding, it's either on a 1, 2, or 3 year cycle. So we have some funding that will last us for 3 years. We also have funding sources that will expire next summer, but we're getting lots of reassurance that as we continue to collect the data, that there's always a great possibility for it continuing indefinitely until it's needed. But as you might guess, there's always ends to grant funding. But we've been telling the folks that the best thing about wages is that the children who are currently in the care will benefit from people staying a year or 2 years longer until those children age out and go on to kindergarten. So the fact that Bethany's been here for 10 years, she was just mentioning to me a family with 5 children, that all the children have gone through the program, and that's why retention is important. Quality staff that are staying for the length of time that the kids and families need them.
Yeah, person. So I don't know if you can speak to this, but it was mentioned $18 an hour is the ceiling for that. What is the average wage that they're earning now and that they will be earning with this wage?
The supplements, as you can see in your packet, are based on their education level. So Kyle was doing some math on those supplements and figured that they were between 7 and 10% of a pay increase over an annual period for those folks. So there are folks working in childcare at everything from minimum wage up into those higher teens per hour. In Iowa, our average rate is just under $10 an hour for childcare teachers and assistant teachers, and home providers are paid even less than that typically. So for the most part, we're looking at a wage that is well below what an individual needs for a living wage, and most of our childcare workforce, if not supporting a family, are mothers and a few fathers, but many, many mothers who are supporting children and families on the wages that they earn.
So what would you say to the people that don't think about early childhood? You know, we've got all these other problems in the world. Why should we care about this one?
Early childhood education is the primary preventative measure that will support children's learning and success throughout their whole lives. So if we can provide quality early childhood experiences, whether it's in childcare, whether it's in family support, whether it's supporting parents as they learn to be their child's first and best teacher, those kind of things have been proven to prevent later things such as the need for special education services, the need for juvenile justice services, the need for remedial services in elementary school for children who are having difficulty learning to read. The cost for providing quality early childhood is multiple times less. There's all kinds of different numbers that people use, but it's multiple times less than providing those services later. And so, if you ask, there are numerous polls that have been done by the Des Moines Register, by other national entities saying, is early childhood education and our young children important to you as a member of the electoral workforce, as a member of our citizenry? And people uniformly are at the 80%. Yes, we care about early childhood education. It's difficult to find money in today's economy for anything that, preventative things are difficult. But when we use preventative measures and provide high-quality services, early intervention, services for young families that they need in order to be the best families they can be, that's when we get the most bang for our buck.
Okay, great. Those are all the
Okay,
questions I had.
great, thank you. Other thoughts? Anybody else want to come up and talk? I'll welcome you.